Some 40% of the drugs available in many sub-Saharan African and South American countries are either fake or substandard, according to research by the World Bank and international public health groups. And experts say the widespread circulation of poor quality or ineffective medicines leads to frequent treatment failure and even loss of life. Experts working to stop this counterfeit drug traffic met in Washington recently to discuss legal and enforcement solutions. Louis Shelley is a criminologist and director of the Terrorism, Transnational Crime and Corruption Center at George Mason University in Virginia.
We're focusing much more on narcotics trafficking rather than on counterfeits that can do harm to many more individuals than consume illicit drugs.
Shelley says sophisticated transnational criminal organizations are behind the manufacture and distribution of drugs that do not conform to proper standards. She says only a coordinated international effort can deal with organized crime on this scale.
I think WHO, I think the law enforcement community, I think consumer organizations, civil society, everybody has a role in demanding greater quality control in the counterfeiting.
You have no assurance of the safety, efficacy, or quality of those products.
Dr. Margaret Hamburg heads the Food and Drug Administration, the federal agency which oversees the safety of drugs and food products in the United States. The FDA took strong action this week against thousands of internet pharmacies selling illegal medical products. Dr. Patrick Lukule of the United States Pharmacopoeia, an organization that sets standards for medicine, says drug purity needs to be ensured through an international initiative because the ingredients come from many parts of the world.
Even in the United States, 80% of active ingredients come from either China or India into the U.S. And so U.S. companies are vulnerable.
In India, you have about 10,000 manufacturing companies. So although the Indian regulators are making investments, it's difficult to catch up.
Andreas Seiter is a global pharmaceutical expert. He says many countries need to increase their regulatory capabilities. And Michael Bates of the World Health Organization says it is not only patients who are ignorant about fake medicines. He says many health professionals are also unaware.
This is quite a complex international trade, and we need greater information on the scale and the scope and the harm and the economic damage that is being done by this issue to convince those policymakers to commit resources to tackling it.
Experts say a worldwide coordinated effort is needed to deal with the problem, including better monitoring and regulation, upgrades in law enforcement capabilities, and the sharing of testing technology. Vidushi Sinha, VOA News, Washington.